Hi and welcome to Necksaviour again. I'm Wes, physiotherapist here in the UK and developer of Necksaviour. Today's discussion is just a quick look at traction, because that's what Necksaviour does. Necksaviour delivers traction at the low end of medical values, but still very therapeutic values. So in the 20 years I've been a physio, there's never been a treatment patients have liked more than traction, neck traction in particular. And also in particular when it's delivered through the base of the skull. So when we use our hands to wrap underneath the patient's skull and gently lever back. Patients love it, and they describe it as feeling as if it's undoing the effects of gravity and undoing the effects of stress. And we all are under an enormous amount of stress these days. So what's it actually doing? Numerous things. By distracting the head from the neck, it's called longitudinal distraction. We're increasing the deep blood flow to the tissues. We're stretching out the ligaments and the muscles, and there are numerous ligaments and muscles in the neck, and in particular at the junction between the base of the skull and the top of the neck. It's stretching out both sets of joints. Now when I say that, what I mean is it's opening up the joints where the discs are between the vertebral bodies, because the spine is made up of a stack of bony blocks called vertebral bodies, and they have a disc in between each one, and that can get compressed and the disc can get worn. But we also have small joints to the side called facet joints, and longitudinal distraction or traction actually opens up both sets of those joints, as well as stretching the soft tissue and increasing the blood flow and opening the space around the nerves. Nerves that, when they're irritated, can lead to pain in the upper limbs and also up into the head. And there can also be a referral pattern that goes on where pain in the neck can refer up into the head and even into the face, but also down into the shoulder and what we call the periscapular region, so around the shoulder blades. So traction is really good for undoing the effects of that compression that we get, and the very real process of a vicious cycle that goes on where the joints become compressed, the soft tissue gets tight, the joints get stiffer, stiff joints are painful, painful joints lead to muscle spasm leads to stiffness, and it just goes round in an ever worsening cycle. So stretching the neck out, and you can do that just by doing some stretches, but to relax onto something like Necksaviour can be very therapeutic, because it does that stretch for you, and in particular at the base of the skull, while you just lie there and relax. So it's very good for stretching out the soft tissue. It's also very good at showing you where you should be again in terms of postural alignment. It gives you that nice chin tuck position again that we all have lost. We should have a shallow inward curve for our neck, but these days on most people it's become excessive through using phones and sitting at workstations and driving, etc. So traction is really good for showing you where you should be again, as well as stretching out all that soft tissue and opening those joints. And as I say, Necksaviour delivers that traction force in a comfortable way and through very little effort. You just have to bend it, lie down on it, and feel the stretch. So that's a summary of traction and a summary of the traction that Necksaviour delivers. But we're here to help. If you have any more questions, please feel free to get in touch.